well, it's 9 o'clock. People will still be trickling in. Just another quick reminder for all the new attendees that just joined. If you have questions, you can submit them into the Q&A feature in Zoom. We mentioned that we'll try to address those throughout the presentation, and we'll have a FAQ portion at the end. But let's go ahead and get started. So welcome, everyone. Today we have a timely webinar focused around the 2022 COVID-19 Supplemental Paid Sick Leave, or SB 114. We're scheduled for about an hour. We have a lot of content to get through. And as I mentioned, we'll have a frequently asked question portion at the end. I'm your host and one of the presenters today, Abe Jaban, VP of Claims Advocacy for ESM Insight, here along with Jennifer Lippy, Senior HR Consultant from our fantastic partners at Silvers HR. Excited to have Jennifer here today. How are you doing today, Jennifer?
I'm doing just great. Nice to see everyone this morning. We have a great attendee list, lots of attendees, and it should be an exciting, fact-filled morning.
Absolutely. Well, as many of you know, she brings a wealth of knowledge and experience to help us navigate through the sometimes tricky and often confusing California benefits waters. So she's fantastic. Happy to have her.
Thank you.
Yeah, absolutely. So some quick housekeeping. I'll mention it one more time. If you have questions, go ahead and put them in the Q&A portion in Zoom. Don't do that on me. So today's presentation is going to be California-centric. California tends to place some additional burdens on employers, as many of you know from the various agencies. It's going to be COVID compliance related, mostly focusing on Spsl. And we're going to go through some questions that you all have submitted prior to the webinar and some questions, time permitting, in the Zoom feature and Q&A. A quick recap of the topics. I'm just going to go through some quick COVID stats, COVID-19 stats, give a masking update, and then we'll get into the main portion, which will be the COVID-19 Spsl. The COVID-19 stats are going to be as of February 15th. And as many of you have seen, we're coming down off a current spike driven by the Omicron variant. Recall that our peak cases were over 100,000 per day in California. According to the stats that we have here from Google, as of February 15th, we have a 7-day average of about 20,000 cases, new daily cases down around 12,000, which is about a 70% drop from 2 weeks ago. Hospitalizations down statewide over 40% from about 2 weeks ago. There have been about 32 million Californians who've had at least one dose of the vaccine, or around 80%. And this falling case rate is really cited for the easing of the masking requirement. So I wanted to touch on the masking requirement today. I'm sure many of you have seen in the news something regarding the indoor masking requirements or ease of them in California, with the exception of a couple counties. Now, as employers, we want to take a look at the emergency temporary standard and really start there with regard to all the different requirements. That's nothing new. It's been implemented since November. There have been some updates in January, but with regard to the masking requirement, they do cite Cdph Guidance, which is the California Department of Public Health. Now, the California Department of Public Health is really geared toward the general population, and the emergency temporary standard is geared toward the work site. And they take cues from each other. CDPH also takes cues from the CDC, but in California, we really need to just focus on, the emergency temporary standard from Cal OSHA and the CDPH that's been implemented statewide in California, with the exception of a couple counties. So with that, who has to wear face coverings? Well, for the worksite, per California's ETS, face coverings are required indoors and in vehicles for unvaccinated employees. You're going to see that be a common theme. Although that they're easing the masking requirements, they're still putting some requirements on unvaccinated people. But regardless of vaccination status, employees in certain indoor settings must still wear a mask if required by CDPH order. And I'll talk about those particular situations, or if they are a passenger in an employee provided transportation. Some exceptions, and this would include obviously unvaccinated people for wearing a face covering indoors if you're alone in a room or alone in a vehicle, when you're eating and drinking, when some type of accommodation is required, perhaps a medical accommodation, or when job duties make a face covering infeasible or create an additional hazard. So Cdph guidance, this is taking effect as of yesterday. I mentioned you're going to have to wear a mask in certain indoor settings regardless of vaccination status. So that means we still have to wear our masks in certain areas. That's going to include public transit, things like airplanes, ships, trains, subways, and also those transportation hubs, airports, bus terminals, marinas, train stations, etc. Also going to have to continue wearing masks regardless of vaccination status indoor in K through 12 schools, childcare, emergency shelters, healthcare settings, correction facilities and detention centers, homeless shelters, and long-term care and adult senior care facilities. I do want to mention that generally speaking, California will be just lifting the indoor mask requirement for vaccinated individuals, citing that falling COVID-19 risk, except for Santa Clara County, Montecito/Santa Barbara, and Los Angeles County. So just something to keep in mind. You want to check the local county just to make sure that there aren't any additional requirements. I know Santa Clara County wants to wait until coronavirus positive hospitalizations remain low and steady. And LA is waiting for the case rates to drop to 50 a week for every 100,000 residents. So you'll want to stay abreast of that if you're in one of those counties. Continuing on with the Cdph guidance, masks are required for unvaccinated individuals in indoor public settings and businesses. So for example, retail, restaurants, theaters, family entertainment centers, state and local government offices. On the other hand, fully vaccinated individuals are recommended to continue indoor masking when the risk may be high. There are certain individuals who are going to be exempt continuing on from wearing a mask, and obviously that's going to be the same people as before: children younger than 2 years old, certain people with medical conditions or some type of mental health condition or disability that prevents them from wearing a mask. That'll also include people who are hearing impaired, or if you're communicating with somebody who's hearing impaired. And finally, when wearing a mask just creates additional risk at the work site, as determined by local, state, and federal regulators. So some exceptions to the rule. So generally speaking, they did provide some guidance for businesses, venue operators, and hosts. So what do you do with these unvaccinated individuals? How do you verify that as a business? So some of the options that they provide, say that you may choose from, is providing information to all the patrons, the guests, and attendees regarding vaccination requirements, and allowing vaccinated individuals to self-attest that they're in compliance. So, hey, I'm vaccinated, I don't need to wear a mask. Implement vaccine verification, some type of system to determine whether individuals are required to wear a mask. The Cdph does have a QR code that you can put on your phone for digital vaccine records, so you don't have to carry around the cards, just FYI. Or you can require all patrons to just continue wearing masks. So you might see some businesses that are still going to require that their patrons wear a mask. And they also note that no person can be prevented from wearing a mask as a condition of participation in an activity or entry into a business. So that is the quick rundown of the masking requirement. And with that, let's jump over to the COVID-19 supplemental paid sick leave portion. Jennifer, you want to take over?
Yes, thank you so much, Abe. Abe had some positive news for you, changing in the masking requirements, some lifting there, and some statistics that looked good. So for my portion, the topic of the hour, COVID-19 supplemental paid sick leave, which is being called now SB 114 leave. I want you to take a big deep breath and get ready to pivot again, learn something, a new law yet again. So I know for a lot of you out there, there's a lot of questions. We're going to do our best to give you the basic information. We're still waiting for the Department of Labor Standards Enforcement to come out with some FAQs to hopefully clarify the some of the unanswered questions that we have. So let's dig right in. On February 9th, as most of you know, the governor signed SB 114, and it requires that employers provide COVID-19 supplemental paid sick leave for covered employees who are unable to work or telework due to COVID-19. And the period it's actually retroactive, and we'll talk about that. It's from January 1st, 2022 until September 30th, 2022. SB is effective. It's not effective until 10 days after its enactment, which is, I believe, this Saturday. It is February 19th. So you still have to a little bit of time to comply here. So that is the period covered by the bill, January 1st, 2022 through September 30th, 2022. Okay, it will sunset on September 30th, 2022. We have no idea what might happen. They might extend it, but for now, that is when it is expected to sunset. This bill is very similar. If you might recall, last year in 2021, we had SB 95, and that also required employers to provide supplemental paid sick leave for reasons related to COVID. This bill is very similar. There will be some things that look familiar, but there's also some key differences. So you can't just roll out what you did for SB 95 supplemental paid sick leave. There's some additional reasons for taking leave. There's some subtle differences in what the law requires. So we're going to talk about that and those key differences in the upcoming slides. All right, so let's talk about who is a covered employer. Who does this law apply to? And it's pretty clear that it applies, and they use the wording, the employers who employ more than 25 employees. This means that it will essentially apply if you have 26 or more employees. The law does not apply to employers with 25 or few employees. Okay, so if you're a smaller employer, SB 114 is not going to apply to you. And it's important to note that it's 26 or more employees, regardless of where they are. You could have, 5 employees in California, but, nationwide, you have 100. So it's important to note that, only the Spsl will only apply to your California employees, but for purposes of the employee count, it's total employees, regardless of whether about, does this apply, for the employee count if you have part-time employees? And yes, I mean, the DLSE could provide additional information in the FAQs, but it really just is employees total and counting full-time, part-time, et cetera. So it's important to note that, you don't back out your part-time employees. It's just employees total. It doesn't state whether they're full-time, part-time, et cetera. So they would all be included and count towards that total. The law just says employees. Okay. And I mean, it raises a question too, what if we didn't have 26 or more employees on January 1st, but now, February 17th, as of today's date, we do. Are we subject to this law? And the answer is yes, because as of the effective date, February 19th, you're going to have 26 or more employees. Okay. All right. Let's talk now about how much leave is required. And this is a little bit different the way they do this under SB 114. The maximum potential amount of Spsl an employee can receive is 80 hours. That's for full-time employees. And it's prorated for part-time and kind of intermittent employees. Unlike SB 95, there are 2 different categories of leaves or banks. if you like to think of it that way, of up to 40 hours available for different qualifying reasons. And we'll talk about what those two categories are. But unlike SB 95, there are two different categories of up to 40 hours available. An employer, there are also limits, just like there was with SB 95. There is both a daily limit and a total limit. So an employer is not required under SB 114 to pay more than $511 a day or more than $5,110 overall. So what that means is, if you have really highly compensated employees who take this leave, they might not be fully compensated because they might hit those caps. They might have to use other forms of leave to, in essence, make themselves whole. Okay, so as you can see, there is a maximum. The way they've done it under SB 114 is just to break it up into two separate up to 40 hours each leave categories or leave banks. All right, let's move on and talk about what you can use it for. What is included in each category? So for category 1, and Abe, if you could forward the slide because it's animated. There are quite a few reasons that you can utilize this first category or bank for. So the first one, and these should look very familiar because they're very similar to what was included in SB 95. So employees must not be able to work or telework for one of the following reasons. The first one is that the employee is subject to a quarantine or isolation period related to COVID-19. As defined by federal, state, or local orders or guidance. And this in and of itself, number one, really is, the new Cdph isolation and quarantine guidance. If an employee has to isolate or quarantine due to that guidance, they'll be covered under reason number 1. Number 2, the employee is advised by a healthcare provider to self-quarantine or isolate. This was one of the reasons under SB 95 as well. Number 3, the employee or one of their family members is attending an appointment to receive a COVID-19 vaccine or booster. This is one area where it's a little bit different. Under SB 95, family members were not covered. Now, not only is an employee covered if they're receiving a vaccine, they have an appointment, but if they need to attend for a family member. So that's a little bit of a distinction. Number 4, an employee or family member is experiencing symptoms related to COVID-19 vaccine or booster, and note too that booster is included here, that prevents the employee from being able to work or telework. Okay, family members are included there for vaccine side effects. Number 5, the employee is experiencing COVID-19 symptoms and seeking a diagnosis. This was one of the reasons under SB 95 that you could take leave, so that should look familiar. Number 6, as you can see, there's quite a few reasons under this first category. An employee is caring for a family member who is subject to a quarantine or isolation order, or who has been advised by a healthcare provider to self-quarantine or isolate. And then finally, the employee is caring for a child whose school or place of care is closed or otherwise unavailable due to COVID-19 on the premises. And the way that was worded was very intentional because the law was trying to make a distinction between, when we had school closures and employees' children had to do distance learning, and whether that meant the school was closed. And this is much more specific. It's because the school or place of care is closed due to COVID-19 on the premises. That means that, this class has been shut down, the school has been shut down because of COVID actually occurring at the school, not because there's distance learning, as it was very early in the pandemic. So many of these should look familiar. It's really broken down into, if you want to think about it this way, there's different reasons. There's reasons that are related to caring for yourself for COVID-related reasons, caring for a family member for COVID-related reasons, or vaccine-related reasons. One of the main changes to these reasons for taking Spsl is that family members are now covered for vaccine-related reasons. And I should note that family members include, it's basically the same family members that are designated under the regular paid sick leave law, Healthy Workplaces, Healthy Families Act, we call it, but it's a child, grandchild, grandparent, parent, sibling, or spouse. So as you can see, quite a few family members that employees can utilize this leave for. So this is the first category of leave, or the first bucket. We wanted to avoid using that term, but I keep finding myself wanting to use it. So, and it's up to 40 hours for this group of reasons. And then I want to point out that I think as a compromise with some of the employer groups who were having input on this bill, they did put into place some limits on use. So for vaccine-related leaves, there can be a limit per each vaccine or booster. I think, back in the day, employees were using, 80 hours for obtaining a vaccine, and they really wanted to put a limit to curb that abuse. So for each vaccine or booster, an employer can limit the total Spsl to 3 days or 24 hours. But keep in mind, that is for each vaccination or booster. That's not for, if you're getting a 2 dose type of vaccination, it's limited, not to the entire series. It's each vaccine or booster. This also includes, not in addition to time spent attending the appointment, it can relate to having vaccine-related side effects or symptoms. There is an exception, like there normally is, to this rule and this limit. If a healthcare provider verifies that the employee continues to experience symptoms related to a COVID-19 vaccine or booster, then more than 3 days or 24 hours may be available. Okay. So if they get a doctor's note saying they need more than the 3 days or 24 hours, they will be allowed to take more under category number 1. And because it is each vaccine or booster, it might be entirely possible that an employee has, uses all of their 40 hours related to vaccine-related leave if they have to, are continuing to experience symptoms. I call it the continuing symptom exception. So because it is each vaccine or booster, an employee could potentially utilize all 40 hours available for that reason. So I don't know if it per se had the effect that the employer groups wanted it to, of really limiting the total amount of time you could take for this. All right, let's move to category number 2. Okay, this is the second bucket, as we say. Employees will have up to 40 hours if they cannot work or telework. Remember, that's a key portion of this. They have to be unable to work or telework because an employee or a family member for whom the employee is providing care is tests positive for COVID-19. Okay, so this is that additional leave that's available if an employee or their family member tests positive for COVID-19. You can require employees to provide documentation of the test result where an employee or family member tests positive. And I'm seeing a lot of questions about that in the chat about, well, what does this documentation look like? Does it have to be a lab confirmed test? What type of test can it be? And I wish I had those answers for you. Unfortunately, the law does not speak to that. We are hoping that the DLSE will put out some FAQs. I checked this morning and it says that, they're currently updating them. It should be up soon, but we're hoping the DLSE provides some clarification on that, because the law does not state it. Just says you can require documentation. It doesn't say what type of test it has to be. You also don't have to request it. It says you may or you can require it. Okay, so I saw a lot of questions of that coming through, but for this type or bucket of leave, you can require documentation of the test result for the employee or the family member. In addition, if an employee tests positive and wants more than 5 days off under this category, the employer can require that the employee take a diagnostic test on day 5 or after at the employer's expense, and they can receive documentation of that test result as well. Okay, so this is the second category or bucket of of leave. And there is a whole host of questions about, well, what happens if, an employee has something going on where it potentially falls under both buckets, or if it's one bucket and then moves to the next bucket. It's not made clear by the law what you do in those circumstances. We're hoping the DLSC once again provides some additional clarification on those issues. But for example, an employee, might have symptoms and be seeking a diagnosis and then ultimately test positive. So one of those, reasons is under category 1. And once they test positive, it could potentially fall under category 2. So how an employer is supposed to move between those banks is quite a challenge that we really don't know the answer to at this point. I've gotten a few questions from clients about, if an employee asks for retro pay, but they can't or won't provide documentation of the test results, what do we do? And that's a good question, because I don't know about you, but I myself have not been retaining test results from prior tests I've had. So for a retroactive request, that poses a challenge. So, you have a couple of options. You could potentially treat it as a category 1 reason because they had to isolate under a Cdph rule because they tested positive. Remember, for category 1, documentation cannot be required for a test result. So you could potentially treat it under category 1, or you could say, have a policy that you're not going to require documentation or test results for category 2. So you have a couple options in that scenario, but it poses a challenge for employers of how they're going to move between these two different categories where there is some overlap or an employee moves from one reason to another. All right, let's move on and talk about, for full-time employees and part-time employees, who gets what. So because I've said, it's up to 80 hours, 40 hours for each category. And so for full-time employees, they can receive 40 hours from each leave category. And full-time is defined under SB 114 as the employer considers the employee to work full-time. So what that means is it's not necessarily a 40-hour work week. You could have an employee who works 32 hours per week or 37 hours per week. And in your handbook, you define full-time as anything more than 32 hours a week. Well, those are basically going to be deemed to be full-time employees because you consider them to work full-time. So it's those who work 40 hours per week, those who the employer considers to be full-time, or those who on average the employee worked or was scheduled to work at least 40 hours per week in the 2 weeks preceding the day they took the leave. So there's also an averaging method. So there is going to be, quite a few employees who you might not automatically consider full-time because they don't work 40 hours per week. So you need to kind of look at these definitions and deem and read them to determine who will be getting the up to 40 hours per category of SB 114 supplemental paid sick leave. All right, let's talk now about part-time employees. And this gets a little bit complicated, especially if you have employees who work variable schedules. But for part-time employees who have a normal weekly schedule, basically, I work 30 hours per week consistently. They receive the total number of hours they are normally scheduled to work. Okay, that's pretty simple. If an employee works a variable schedule, then it's 7 times the average number of hours the employee worked each day for the employer in the 6 months preceding the date the employee took leave. So that's a little bit of a more complicated calculation. It's going to be a little bit more complicated for those variable employees. If the employee has worked for the employer for fewer than 6 months, because you might have, somebody who's a new hire. And I did see a question about that, and that's one of our frequently asked questions, because there is no length of service requirement. So they could be with you only 5 days and still be eligible. So, but for situations where they have worked for the employer for fewer than 6 months, but more than 7 days, the calculation is made over the entire period the employee has worked for the employer. And if they're variable but have worked for the employer for 7 days or fewer, they receive leave hours equal to the number of hours they have worked. So there is a variety of different calculations depending on what type of schedule your part-timer works. All right, let's talk now about the rate of pay that you have to pay this out at, which is important because you might have paid employees a supplemental benefit back in January. You just opted to decide to continue paying employees leave, but you might have paid it at a different rate than what is required under SB 114. So for non-exempt employees, you have to pay them at their regular rate of pay. And I'll tell you the options for that, but it is different than just their hourly rate. It factors in other forms of compensation. So the regular rate of pay options for the non-exempt employees, and this is only for non-exempt employees, exempt employees or salaried exempt employees are treated differently. You have options of calculating the regular rate of pay for overtime, even if the employee did not work overtime that week. Or you have the option of dividing the employee's total wages less overtime by their total non-overtime hours worked in the full pay periods during the 90 days, last 90 days of employment. Okay, so it's a little bit more complicated for those if you do a look back period for those non-exempt employees. For exempt employees, it's pretty simple. Employers really just calculate Spsl in the same manner that they would calculate wages for other forms of paid leave. So they, however you pay out PTO or holiday pay, you would utilize that same calculation. All right. Somebody asked if we could quickly go back to the prior slide about part-time employees. I don't know if anybody had questions about that. If so, put them in the chat box. I know it was a lot of information on how you calculate for part-time or variable employees. All right. And a lot of people are asking if we can have the slides available. I believe that it's going to be sent out after the webinar. And if anybody who's looking for definitions, et cetera, all of this is in SB 114 for how you calculate the regular rate of pay, how you calculate variable hours. All of this is in the SB 114 itself. All right, moving on to some questions that I think you all have. What about this retroactivity? This is a nightmare. And yes, it really kind of is. And I mean, I guess the good news is they could have made this retroactive back to September 30th, 2021, when SB 95 expired, but they didn't. It's only retroactive back to January 1st. So if an employee took time off for reasons covered under SB 114, any of those in category 1 or 2, they're entitled to retroactively use SB 114 leave, unless the employer can claim an offset, which we're going to talk about on the next slide. So for your employees who took time off, because they had COVID, because they needed a vaccine or booster, and perhaps they used paid sick leave or other paid time that an employer provides, well, they potentially can get a credit for that. So if an employee used any form of paid time off, the employer has to credit that time back to the employee, which makes things kind of an administrative challenge, right? So, and I see a lot of questions coming through about, do we automatically have to approve all retroactive requests? And the answer is no. Employees have to make an oral or written request for this retroactive pay. Okay, so I mean, you have to make a business decision. Do you want to look back and find out how many of them you have, and if you just want to pay them automatically? If not, you can wait until you have an oral or written request from an employee. Retroactive payments have to be paid by the next full pay period after the employee's oral or written request. Okay, so that's when it's payable, but technically you can wait for a oral or written request from the employee. It's not automatic. So the good news is you don't have to worry about doing all this automatically. Okay. Somebody asked, what if the incident occurred prior to January 1st? Well, no, if they didn't take time off for a reason covered under SB 114 from 1/1/22 and forward, it wouldn't be covered. I know a lot of people were out between 9/13/21 when SB 95 expired and now, but they didn't make it retroactive back to that period. Okay. This is going to be an FAQ. I can't help but answer the questions as they come through, but what if they're no longer with the company? Well, former employees, if they are not with you on the effective date of this, which is February 19th, 2022, then they are not considered an employee. So former employees are somewhat a non-issue with respect to this. I have had a couple of questions about, well, what do we do if an employee quit and their final paycheck is due? Well, if it happened before the effective date of this and they did not make an oral or written request for it, I don't believe you're going to need to pay out. The way I interpret it, you're not going to need to pay out that Spsl leave automatically because number one, they weren't an employee on the effective date, and two, there was no oral or written request necessarily. So retroactivity is going to be an administrative challenge. And there may be some circumstances where an employee took time off for reasons related to SB 114, but the employer, provided a supplemental benefit or more leave than they had to, and the employer can claim what we call an offset. So let's go ahead and take a look at what offsets are and when you can utilize them. So if an employer paid a COVID-19 supplemental benefit, which means maybe you offered to just continue what was available under SB 95 for employees, and you paid employees the time off to get vaccines or because they were out sick with symptoms or with COVID-19 positive test results. So maybe you opted to provide some type of supplemental benefit, even though you did not have to after January 1st. You can receive an offset as long as you provided leave for the same reasons that are covered under SB 114 and you paid it at the same rate. And that might be a challenge. Maybe you just paid the employee at their hourly rate. You didn't factor in the regular rate of pay, which considers other forms of compensation. Well, in that regard, you would probably need to do what we call a true up. You would need to go and pay them the difference between what you paid and what is required under SB 114. Okay, so that you might be required to make up the difference if you paid it at a different rate. Okay, you cannot count sick leave paid under the Healthy Workplaces, Healthy Families Act. Okay, you are required to provide that under the law. That is not a supplemental benefit. So if you've just allowed employees to use their own, regular paid sick leave, that you're not going to get an offset for that. In fact, an employee could claim a credit. They could say, hey, I had COVID and you required me to use my 3 days or 24 hours of Healthy Workplaces, Healthy Families Act. I, would like to potentially receive a credit for that and substitute in this SB 114 supplemental paid sick leave. Okay, so you cannot count that leave provided under the Healthy Workplaces, Healthy Families Act because it's not a supplemental benefit. Employers can also count local COVID. If you're in a jurisdiction and at this point, I'm not sure, a lot of them have expired. Sacramento's have here locally back in 2021. So there are some that are outstanding, but if you paid supplemental paid sick leave towards a local ordinance requirement, that can potentially count towards your SB 114 obligations. Once again, it has to be for the same reasons listed in either category 1 or category 2 and at the same required rate. And somebody just asked, does regular California paid sick time count for the offset? And the answer is no, it does not, because you're required to provide that. That was not a supplemental benefit you provided. So you can't get an offset for that. And in fact, employees, you might have to credit them for time that they took out of those banks and substitute it for this new SB 114 leave. Somebody asked, if permitted to work remotely, is there no additional pay? Yes, all of these, both categories were prefaced with, they have to be unable to work or telework. So if an employee can telework, then you're just going to pay them their normal great, they're going to be working. It's only if they cannot work or telework. All right, let's move on and discuss. I just saw a question pop up about it. Exclusion pay and Spsl. This is a big hot topic question. For those of you who attended, we just did a webinar with ESM a ways back where we discussed exclusion pay. So for those of you, I'll just give you a brief primer on it if you're unaware of what exclusion pay is. But exclusion pay is something that's required by the Cal/OSHA ETS. And it applies where employers have to exclude employees who have had workplace exposures. Workplace exposures. I want to clarify that. It's not they got COVID at home and were exposed at home or at an event. So it's where employers have to exclude employees because of a workplace exposure through no fault of their own, and they have to be out and can't work. They are entitled to what's called exclusion pay, which is basically where an employer has to continue their earnings. And it's really out of the employer's pocket. You can't require for exclusion pay that they use PTO, vacation, sick leave. Okay, so it's a big burden on employers. So employers have to pay exclusion pay where there is a workplace exclusion, where you're required to exclude an employee because they have been exposed in the workplace. Okay, and Cal/OSHA's rules require exclusion under some of those circumstances. So unfortunately, I don't have very good news in this regard. Okay, employers may not require employees to exhaust this supplemental paid sick leave if they're eligible for exclusion pay under the Cal/OSHA ETS. This is very different than SB 95, the prior Spsl law. That required employees to use supplemental paid sick leave before moving on to exclusion pay. So really what that means is they can save up this SB 114 time, which blows my mind because it was already a burden to provide exclusion pay, and you really aren't even going to get the benefit of being able to utilize SB 114 leave before you pay out exclusion pay. Okay. Somebody asked, is a positive test required for exclusion pay? And the answer is no, because exclusion pay is not for people who test positive for COVID. It is only for employees who are exposed in the workplace and have to be excluded for the quarantine period because they were close contacts. Once you test positive for COVID, there is other wage replacement. You can file a workers' comp claim, SDI, and now you can be eligible for SB 114 leave. So this is not good news. Don't shoot the messenger. We might have a few clarifications from the DLSE, but as it's currently written, you can't require that they exhaust this SB 114 leave first before utilizing exclusion pay. So they can really save it in essence. I will keep you posted if we hear any updates when we see the FAQs come out. All right, let's move on now to notice and pay stub requirements. I have seen a bunch of questions come in. How are we required to tell employees about this, et cetera? Well, in the nick of time yesterday, the DLSE, the Division of Labor Standards Enforcement, who is responsible for publishing a model notice, came out with one. It was released yesterday on the 16th. In the additional resources, this is listed as a link for you guys. Paulette, who's one of my clients over there, just put a link to the Cal/OSHA ETS FAQs as well, but we will be posting it in the chat as well as it's in the additional resources. So that's on your to-do list. And I'm going to give you a list of things for your to-do list at the end, but you need to post the DLSE model notice that provides employees with notice of their rights under SB 114. If you have employees who are teleworking, you're going to want to, you can email this to them. There are options for electronic notice. Now moving on to pay stub requirements. There were pay stub requirements with SB 95 leave as well, but employers have to list the amount of Spsl available and the amount of leave used through the pay period. Okay. So you have to state the amount available as well as the amount of leave used in the pay period. So if an employee did not use any during the pay period, you're going to list 0. Okay. I got a question, I think, in the chat at one point about, does there need to be 2 different line items for the two different categories of leave, and that question is not clear. It's not clear at all whether or not you need to have two separate line items. It is clear that it needs to be a line item that's separate from Healthy Workplaces, Healthy Families Act leave. Somebody says, I don't think the amount available needs to be listed. And that was my understanding at first as well. But if you go back and read SB 114, it makes a reference to labor code section on the Healthy Workplaces, Healthy Families Act, which does state, because for that law, you have to have the amount available. So technically, I know you're right. When you read it, it doesn't say amount available, but there is a reference to the labor code section for the regular paid sick leave, which says you need to essentially list the amount available. So it's tricky. That was my understanding too. You only need to do the amount of leave used, but technically you also have to list the amount available. And it's a challenge. Somebody said, well, how do we do this for part-time employees? Well, you have to use those calculations and say, do they have a normal weekly schedule? Then it will be, that amount, et cetera. So, employers may provide this information, and everybody's saying, how do we do this? This is so burdensome. And the other option is, and you might get payroll companies who say, we can't do this, we can't make this happen. Well, that's what they said when Healthy Workplaces, Healthy Families Act came out too. But you have the option to provide the information in a separate written document. Okay, so you can include that with the pay stub. You can include this in a separate written document. Create a spreadsheet that's detailing each pay period, what they have available, and the amount that they have used. So you can prepare it on a written document. So that's also an option for people who are very concerned about making this happen because there are quite burdensome pay stub requirements. All right, I'm going to move on now and address some FAQs.
Great. Well, a lot of information, a lot of great information. We're going to try to address some of the frequently asked questions that we've been getting as well, that some of you have submitted prior to the webinar, as well as some that we just get commonly. So I'll go ahead and jump forward. The first question is, what steps do we need to take to prepare to implement SB 114?
Yeah, and here are some basic things that will help get you ready for the 19th. You need to read the bill. It's nothing works better than getting out and reading word for word what it says. So I would recommend reading the bill itself. Obtain and post the model notice. We provided that here today. You can also find it on the DLSE website. That is going to help you come into compliance. That's a really easy, quick thing you can do. Next, work with your payroll company to ensure that your pay stubs are going to reflect the SB 114 leave, or prepare a spreadsheet that you can use as a separate written document that will go along with the pay stub to reflect this. And it would be a good idea to prepare an SB 114 policy. You can't just roll out whatever policy you had before for SB 95, supplemental paid sick leave. There's different reasons for using leave. There's a variety of different reasons. In addition, it's not a bad idea to create a absence request form. And for our clients on the line, we have one that we're preparing specific to SB 114. So employees can make requests, make retroactive requests, etc. So those are the top things I would recommend doing in order to get ready to implement this on and after the 19th.
Great. What about if an employee is retro eligible but has since terminated employment? What are the employer's obligations?
Yeah, well, there is basically no entitlement to SB 114 Spsl for former employees. If they were not employed with the employer as of the effective date of the law 2/19/2022, they're not going to be eligible. Okay, so you don't really need to worry about former employees. That's one bit of good news. All right, next one.
What about tax credits?
Yeah, and this is a frequently asked questions we're getting from a lot of our clients. I've seen lots of questions. Who's paying for this? And unfortunately, the employers are footing the bill. There are not currently any COVID-19 tax credits that come along with SB 114. It's very different than, back with SB 95, we had tax credits available under the FFCRA, the American Rescue Plan Act. There are no such credits available as of now. I mean, there might be some sector or industry specific tax credits. If you're inquiring about tax credits, I'd recommend talking to your tax professional, but that's a bit of bad news. Employers are pretty much footing the bill for this. There is no tax credits available as of right now.
I think we partially touched on this, but do you count part-time employees, and also do you count employees that are off on a medical or leave of absence?
Yeah, and you are. It's the way the bill is read. It says employees, period. It does not state part-time is not included. If they wanted to include that, they could have stated so. So yeah, you're going to include part-time employees. And employees who are maybe on your books, but might be off and not receiving paychecks, they will be counted as well, as my understanding, at least unless we receive clarification otherwise. I also saw a question that said, what about owners? Do owners count? And the law does not address this question, but for purposes of other laws and the way employee counts are decided, they will count towards the 26 employees, typically if the owners are on payroll, if they are a working owner and contributing to the workflow and daily work of the firm or the company. So typically, yes, owners are included. If they're a working owner, they're involved in the business, they're on payroll, et cetera, they will count. So that was another question I saw come through.
All right. If employees have already been paid for COVID via workers' comp or disability benefits, are employers still required to pay COVID time off?
Yeah, and this was a really good question because, as I said before, for a period of time when there was no supplemental paid sick leave available, one of the only forms of wage replacement for employees who had COVID was to potentially file a workers' comp claim, or they could apply to SDI if they, had long haul COVID and receive benefits. So that begs the question of, can we not pay out supplemental paid sick leave if they were compensated this way? And the law does not address this, but most likely there would not be an offset because here the wage replacement did not come from the employer. This was provided either through workers' compensation or through EDD, through SDI. So while the law does not address this, I think that you would still have to pay Spsl because it's not this wage replacement was not coming from the employer. We might get some clarification on that from the DLSE.
All right, are we allowed to exhaust an employee's sick or vacation accruals prior to providing SB 114 Spsl?
Yeah, and that's a great question. One I saw come through on the chat box and the Q&A often this morning. And the answer is no. You cannot require an employee to use sick or vacation prior to providing Spsl. The law itself specifically says an employer shall not require a covered employee to use any other paid or unpaid leave, paid time off, or vacation time provided by the employer to the covered employee before the covered employee uses COVID-19 supplemental paid sick leave. So that is one thing that is quite black and white. You cannot require, and I mean, in general, with regular sick leave, you can never force an employee to use Healthy Workplaces, Healthy Families Act paid sick leave. So for that reason alone, you would not be allowed to require they exhaust it first. So unfortunately, no, this SB 114 leave is going to come in first, and you can't require them to utilize those other paid leaves.
All right, if an employee's isolation period is only 5 days, but their medical provider takes them off work for a longer period, are we required to continue to pay Spsl?
All right. Yeah, I mean, this is a tricky one because typically, for some employees, the isolation period may only be 5 days. But if you have a doctor's note or medical advice putting them off work longer, the law doesn't specifically address moving in between these buckets or these categories, but I think that yes, you're continuing to require SPSL. And the reason is because I think they could move from category 2 back to category 1, because now they have advice from a healthcare provider that's requiring them to isolate due to COVID-19. So it's one of the reasons listed under category 1. So I think they might be able to move from category 2. And then once the medical provider puts them off work longer and tells them to isolate, then you have a different reason coming from category 1 or bucket 1. So yes, I think in that situation, you would be required to continue that pay. And I mean, also employees are really, the way I read the bill, they're deciding which category and which bucket of leave they want to utilize. It's kind of the employee's call. So, it's not necessarily the employer's call to designate which category it will go into.
What type of documentation is acceptable as proof of a positive test?
Yeah, and I mean, this is one of the most frequently asked questions, and I wish I had, a crystal ball and could tell you what the DLSC is going to say, because it does not state whether it's a lab confirmed test, whether whether rapid test is going to suffice. There is some interaction with the Cal OSHA ETS where if you take the test on day 5 for return to work standards, that's required to be proctored either by the employer or a telework professional. So it might be that for those types of tests, acceptable documentation could be, proctoring a self-test. But for purposes of, the initial test, for family member proof of positive tests, the law just does not speak to it. So I'm assuming the DLSC is getting this question just as we are, and that they're going to provide clarification on what acceptable documentation means when it comes to a positive test. Does an employee, go ahead. I'm sorry, I'm jumping right ahead.
No, go ahead. That's fine. I think we already answered this one anyway, so
yes, I think
we can touch on it again.
Yeah, I think we did address this in passing, but does an employee have to work for the employer for a certain period of time to be eligible? And no, there's no length of service requirement in order to be eligible for SPSL. No 30 days, no 6 months, etc. They're eligible automatically.
All right. What about paying out retroactively? Is it automatic?
And the answer there is no. You do not have to pay it out automatically to anybody you believe may have been out for a qualifying reason since January 1st. You need an oral or written request. So you can make the call as to whether you want to just pay it out automatically, but you're not required to. Okay, you could certainly decide to do that, but you're not required to. You are only required to pay it out after an oral or written request.
Okay. What about next steps? Anything you want to mention here?
Yeah, I mean, moving forward, it's going to be really, really important that you check in with the DLSC, basically bookmark their website and attempt to find out when their FAQs are coming out, because I think some of these unanswered questions are going to be addressed by the DLSC. You're also going to want to read SB 114. Post that model notice that you guys all should have access to now, and work with your payroll company to ensure that the pay stubs meet the requirements for SB 114. Those are my top tips.
Okay.
We have about 2 minutes, and I know there are so many questions that came through. So are there any that you think were major questions that haven't been addressed that I could address in the last 2 minutes here?
Yeah, I think we addressed a lot of them as we went through. What I can do is provide additional resources here, and maybe you can take a quick peek if you saw anything that popped up that you can answer on the fly. And while we do that, I'm going to have Alyssa put some additional resources in here, including the DLSE poster, the Cdph guidance on the use of face masks. I think we've had it posted already, but the OSHA emergency temporary standard FAQs. And then we also have obviously Jennifer's email here, and you can reach out to us as well at info@esminsight.com. Jennifer's is at jennifer@silvershr.com.
And somebody said, does exclusion pay apply to smaller employees? Yes, there is no employer size when it comes to exclusion pay. Also, somebody wanted me to confirm, does this apply to employers with 25 or fewer employees? The answer is no. You have to have 26 or more. But my understanding is that if you become an eligible or covered employer at any time during, the applicability of this law, you will be covered. Just because you weren't covered on February 19th, going forward, you will be covered. So just because you aren't now doesn't mean you might not become covered in the future. Final question I will ask, because it's answer 10 o'clock because it's in front of me right now, is does this apply to union employees covered by a collective bargaining agreement? And my answer based upon my read of the bill is yes. It does not specifically appear to exclude them. The Healthy Workplaces, Healthy Families Act, the original paid sick leave law said, if you offer a CBA that offers just as much paid sick leave, you could potentially count that, but I see no such provision in SB 114. So you might want to talk to your union reps about negotiating that. All right, well, tons of questions still here. We might have to do a follow-up webinar on this once we know more.
Yes, absolutely. And I just put a couple slides up if you have any questions about some updated compliance. Alyssa's going to be putting in some additional links to our learning management system. And finally, just wanted to thank you all for joining, for all the fantastic questions. Special thanks to Jennifer and the Silvers HR team for all their guidance and resources. And with that, I'm wishing you all a wonderful day. And as always, stay safe.
All right, take care, everyone.